Hi, thank you for joining today's discussion on Medicare Supplement Insurance. Today we're going to be talking about the Medigap tool, which is part of the financial ratings database that you have at the library, and how it can help you pick the right plan and get the best rate. We're also going to uncover some secrets that you may not know. So my name is Paige Grillo. I'm an account manager with WEISS Financial Ratings. I am not an insurance salesperson. I'm not an insurance professional. I work at WEISS with the database, and I work with libraries on their subscriptions, and I support them through patron programs such as this. So WEISS Financial Ratings and Gray House Publishing teamed up to bring this information to you. They are independent, unbiased, and accurate. So today's discussion is designed to help you navigate through the Medicare maze. It can be a very confusing subject. Our goal is to help you, to tell you about the choices that you have and help you save as much money as possible. When we're done, you'll be able to download your own customized Medigap report, and that will help you find and select the best Medicare supplement insurance policy for you with the strongest companies for the least amount of money, and best of all, you get to do it for free with your library card. So here's what we're going to go over today. Major expenses that Medicare doesn't cover. When is open enrollment and what does that mean? Why Medigap can be better than Medicare Advantage. Not saying that it necessarily is, but for some people it might be the better choice. How to get lower premiums and save hundreds, even thousands of dollars. So let's start out with talking about your initial enrollment. So when can you join Medicare? When you turn 65, that's your initial enrollment period, and you have 3 months before your birthday, you have the month of your birthday, and the 3 months following. So that makes up the 7 months. So if your birthday was in July, you would have April, May, June for the 3 months before your 65th birthday, the month of July, which is the month of your birthday, and then the 3 months following, which would be August, September, October. So that is your 7-month initial enrollment period. After that, there's an annual open enrollment period, which is October 15th to December 7th. I am recording this on October 23rd, so we are just 1 week into the open enrollment period. If you are still working and covered by insurance, Medicare can supplement your employer coverage. If you are still working and plan to keep working, even though you've turned 65, I recommend that you go ahead and get enrolled in Part A, which is the medical insurance. So the Medicare Part A, it does not cost you anything, and it gets you into the system and helps you avoid any problems down the road. So let's look at the coverage. So you have Medicare Part A, which is hospital insurance, Medicare Part B, which is medical insurance, Medicare Part C, which is Medicare Advantage. I'm sure you've heard the ads for Medicare Advantage on the television. Last, we have Medicare Part D, which is the prescription drug coverage. So Medicare Part A covers hospital-related services and emergency care, such as inpatient hospitalization, home health services, skilled nursing services, and hospice. You should know that it does not cover all of your hospital costs, and it does not cover long-term care. Part B will cover some regular medical care and helps with outpatient services. So doctor office visits, laboratory services, ambulance, and diagnostic services. You might think you're covered, but just by saying this, I'm sure you figured out that you're not. Medicare does not cover all of the costs associated with hospital and medical, and it does not include prescription drug coverage. So let's take a look at what some out-of-pocket costs could be. This says out-of-pocket costs for 2020. As far as we know, there aren't any changes to these numbers for 2021. It doesn't mean that they won't change, but this will give you a good idea of what the out-of-pocket costs are. So let's start with Part A. Right off the bat, you've got that the deductible. So Part A is your hospital. So you have a hospital deductible of $1,408. Once you have reached that, they will cover 100% for days 1 through 60. After that, hospitalization costs for days 61 through 90, you are out of pocket $352 per day. Beyond 90 days, it's $704 per day. If you go into a skilled nursing facility, the first 20 days are covered. Days 21 through 100, it's $176 per day. Following that, after 100 days, you are responsible for 100% of the costs. Taking a look at Part B, which is your medical care, you have an annual deductible of $198. Once that has been satisfied, most outpatient services and medical supplies are covered. You would pay 20% of the total amount that Medicare approves. So if it's a Medicare approved amount or expense, and whatever that amount is, Medicare will pay 80% and you are responsible for 20%. You also have a Part B monthly premium. If you're collecting Social Security, that is taken out of your Social Security check. If not, then you pay it separately. The monthly amount depends on your income, and the lowest amount that you would pay is $144.60. Depending on your income, it could go up from there. Some other hidden costs of Medicare: prescription drugs, vision, emergency care abroad, dental, and hearing aids. So none of these things are covered. So you do have choices, and based on your individual needs, you can make the right choice. So in 1965, when Medicare was established, it wasn't meant to cover all of your care for your senior years. It was designed for basic needs. You do have choices in regards to your health care. You can stick with Medicare Part A and Part B, or you can purchase additional coverage, but you'll make this decision based on your unique health care needs. So you do have a couple of choices to fill in the gaps. First is Medicare Advantage, otherwise known as Medicare Part C, or Medicare Supplemental Insurance, known as Medigap, and that's where we're going to focus most of our attention here today. So Medicare Advantage Part C is coverage that's provided by private insurance and is limited to a defined network of doctors and providers, and it combines your Part A and your Part B medical care, your Part A hospital insurance and Part B medical care, and often will include the Part D prescription drugs. Looking at Medigap, it covers your deductibles, co-payments, and co-insurance, and is designed to fill in the gaps that Medicare Part A and Part B don't cover. So you do keep that Part A, Part B, and then you add in the Medigap to fill in the gaps. So look at these in another way. So here we have Medigap. Right there it says original Medicare plus a Medicare supplement. So it's Part A, Part B plus the supplement. What this provides is higher premiums but no copays, a freedom to choose doctors, no referrals are necessary, but some routine services are not covered, such as vision, hearing, and dental. You're covered anywhere in the United States, and some of the plans offer coverage abroad. With Medicare Advantage, you are just choosing a Medicare Advantage plan. Uh, Generally, it has lower premiums, but you're going to have copays. You may be restricted to a network, and you may need referrals for specialists. It will possibly include extra benefits such as vision, hearing, and fitness, and dental. And outside of your service area, you're going to be limited to emergency services only. So I talked about secrets. First secret, Medigap plans offer identical coverage. So what does that mean? So there are 10 Medigap plans, each known by a letter. And within every lettered plan, each plan has a set of benefits. It's regulated by the federal government, so they say these are the benefits, and anybody providing that plan has to provide the benefits that are part of that plan. So the coverage within each plan is the same regardless of who you choose to provide it. So whoever you purchase your plan from, whichever insurer you purchase it from, they are going to provide you the exact same benefits as any of the other folks within that plan. Simply said, that means that all Plan A's have the exact same coverage, all Plan B's have the same coverage, all Plan F's, all Plan G's, etc. You can pick the plan that has the coverage that you want, and you can compare one insurer to another, and you can pick the plan that has the best rate. So when you're picking a plan, some things to think about. First off is, what's your budget for your insurance plan? If you know that number, then now you can look through all the plans and find the one that has the coverage that you need and want and within your budget. Another thing to think about is, do you think you're going to want or will need nursing care? Looking at your family history, if there's a history of nursing care, it's possible that that's something you might need in the future. Do you do a lot of overseas travel? Then you might want to pick one of the plans that includes some emergency care in a foreign country. Also, what you are going to want to do is weigh the different, what's best for you in terms of paying a higher premium for more comprehensive coverage, or paying less is the most inclusive. So secret number 2, Medigap plans are standard, but their rates are not. So here's the secret: the rates are not standard. The premiums can vary thousands of dollars a year for the exact same coverage. So let's take a look at an example. We have this woman who's 65 living in Crown Point, and she's decided that Plan G is the right plan for her. So she ran a report, and looking at the report, she goes to the rates for Plan G, and they're organized by plan, and then within each plan we organize them by the safety ratings of the companies. So the first grouping of companies is going to be the companies that have a safety rating of an A+ through a B-, and within that grouping we see that the lowest premium available to her is $1,322, or she could spend as much as $2,453. Again, both you see from left and right here, they're both Plan G, so it's the same benefits, but a big difference in price. In fact, it's over $1,100 difference annually for the exact same plan. So the beauty of this report is that you get all of the plans available to you based on your age and gender and where you live. So all the plans available to you, and then you see all of the rates, and it's just organized in a very easy to read way. So if we look at this over 10 years, that's an $11,000 savings over 10 years. So again, really great information to get. let's take a look at this gentleman who's 68. He lives in Crown Point also. He has decided on Plan A. And again, I used the same safety rating criteria. So these are rates for companies that have a safety rating of A+ through B-. The lowest premium he could pay is $1,319, and the highest would be $3,043, which is an annual savings of $1,724. So again, same benefits, but a difference in price of $1,724. So over 10 years, that's $17,000. So again, great information to have. Now we have this couple, she's 65 and he is 68. Again, they live in Crown Point. They're both going to take Plan G. So looking at the combined premiums for them, because they're different gender, different age, they had different premiums. But when we combine the two of them, the lowest rate is $2,843, and the highest premium is $5,770. Again, this is using that criteria, that safety rating criteria of A+ through B-. So in 1 year, that's almost $3,000 savings by choosing the lower premium, having that information at $2,927 difference. And again, across 10 years, $29,270. So let's just take a look at this chart again. The other thing I wanted to point out here is, so in beginning in 2020, January 1, 2020, if you were just signing up for Medicare, you could not get Plan C, Plan F, or Plan FHD. What they do have, however, is Plan D, which is just the only difference between Plan D and Plan C is this Part B deductible. And again, for Plan F, which you cannot get if you're signing up after January 1st, 2020, your option is Plan G. Again, the difference is this Part B deductible. And the difference between these two, Plan G and Plan F, the Plan F is more expensive than Plan G, and in fact, it's more than $198 more expensive. So Plan G becomes the better value. With Plan D and Plan C, it's not as fine a line, but again, if you wanted Plan C, your option is Plan D. The other thing I wanted to point out, so Plan A, least inclusive, at $1,122 annually. If you come over to Plan G, most inclusive, it's a $200 difference. So having this information to see, having that report, and somebody can take a look and say, you know what, I could do the $200. That's in my budget to have spend $200 more each year on my insurance premiums and have the better coverage. So not only when you're comparing within a plan, but comparing one plan to another and what's available to you for the rates. So just wanted to point that out to you. So how safe is your insurer? You heard me talk before about the safety ratings, using that as a criteria. So WEISS safety ratings. So in the WEISS Financial Ratings database, we have investment ratings, which are based on buy, hold, well, for buy, hold, and sell for stocks, mutual funds, and exchange traded funds. And then we have the safety ratings for banks, credit unions, and insurance companies. So that's what we're looking at here. These safety ratings refer to the financial strength and stability of an institution. So A is excellent, B is good, C is fair. I'd say anything in the ABC is something to look at. You probably want to stay away from D-rated or E-rated companies, because the financial stability there is weak and very weak. So you paying all your money to these people for your insurance. You want to make sure that they're there for you when you need them. So secret number 3 is that safer insurers are not necessarily the most expensive. So looking at the premiums in Plan G for a 65-year-old woman in Indiana, we see we looked for an A-rated insurer, so that was number 1. So the annual premium was $1,507. Insurer number 2 had a B rating, so that was $1,322. Insurer number 3 is C-rated company at $1,017, and then insurer number 4 with a D rating at $1,258. So depending on where you live, these the swings on the cost will be different, but really what I want to point out here is the rating does not necessarily impact the premium. As you can see, there's not a whole lot of difference between these. So it turns out that in this particular case, running the report for Crown Point, Indiana, there wasn't a big difference in the premium rates. In other areas, you will see bigger swings and find that sometimes the C and D rated insurance companies are more expensive than the A and B rated companies. So higher premiums don't mean you're getting coverage from a stronger, more financially stable insurance provider. And the last secret is that you get to make the choice. You can get more coverage for less, reduce your premium. Oop, trigger happy here. And balance financial safety of your insurer with your choice of plan. So let's just review those secrets again. Medigap plans offer identical coverage. Medigap plans are standard, but the rates are not. Safer insurers are not necessarily more expensive. Lastly, you get to make the choice. So when you run your report, what you're going to get out of it is that it's going to help you make the right choice for you in your specific situation. It'll help you to pick the right coverage, pick the lowest rate, and it's going to save you time and money. Money, obviously, through the premiums that you're paying, but the time part is that it takes roughly 30 seconds to run this report, and then you have all the information you need to make your choice versus having to make a lot of phone calls, go to a lot of websites, put a lot of information down on paper, and hopefully be able to organize it in such a fashion that you can make some sense out of it. It's going to help you pick the best and most affordable plan from all of the available providers, and it's customized just for you. So it's customized for you based on your age, gender, and where you live. And finally, we said this before, you get to do it for free because Crown Point Public Library subscribes to this tool. So questions, concerns, thoughts people have. So when you're shopping for plans, be aware, be advised that not all insurers cover all areas. That's the whole point of the putting in the zip code. So individual insurers might not have the plan that you want in your area, or they might not have the lowest rate. There are some websites out there where you can search for plans. You should know that one of them, My Medicare Matters, if you use their plan search tool, you will be directed to a commercial partner's website who might only offer a limited number of plans. So you might not get all of the information, all of the plans that are available to you. Can you make changes? So, first off, you sign up for Medicare when you turn 65. You can sign up later, most times without penalty, as long as you were covered by a group health plan because you or your spouse were still working. If you don't sign up for Medigap when you join Medicare at 65 or when you stop working, it can be tricky to sign up later. You could be subject to medical underwriting, be denied coverage, or be charged extra. If you have a Medigap plan now and want to change your plan or your insurer, you do that during open enrollment period, which is October 15th through December 7th. We talked about that earlier. Today is October 23rd, so folks are looking at this right now and making their decisions, and then their coverage will begin January 1. If you have Medicare Advantage and you want to disenroll from that, you can do that during January 1 through February 14. If you do Medicare Advantage first or have it for more than a year, it can be difficult to leave and join Medigap later. I will say that different states have different regulations on that, so I would check that out. I think on Medicare.gov you can go and find specific state information. So I know it is different from state to state. Changes coming soon. So far, there have not been any changes that we have heard of for 2021. What I do know of is just what we talked about earlier. If you start Medicare Part A after January 1st, 2020, Plan C, Plan F, and high deductible Plan F are not available to you. We talked about that. If you had signed up with Medicare Part A prior to January 1st, 2020, you can continue to enroll in Plan C, Plan F, and the high deductible Plan F. And then we talked about considering Plan D instead of Plan C, the difference being the $198 Part B deductible, or Plan G instead of Plan F. And again, the difference is that $198 Part B deductible. Medigap tool does not do anything for your prescription drug coverage, which is Medicare Part D, but we want to include this here because we are talking about Medicare. So if you're just signing up, you need to, and you have prescriptions, you want to go ahead and take a look at this. You shop for it at medicare.gov/find a plan. Again, it does work on the zip code area, so it'll walk you through what you need to put in. But fees and copays will vary by plan, and also the drugs that each plan covers will vary. So have a list of those prescriptions that you take with you when you sit down to find a shop for a plan. Looking at the pricing, here's an example. You could have a $435 deductible, a $24 a month premium, and then copays and coinsurance. If you join Medicare Part D late and you didn't have any qualifying coverage prior to that from another insurer, you could pay a penalty based on how long you weren't covered. If you decide against Medicare Part D, you can take a look at there's lots of discount cards out there that are available, but just be aware that some of them have a monthly or yearly fee. So some things to keep in mind when you are shopping for that coverage are your prescriptions on the plan's formulary. So that's why I said to have that list, in front of you with your prescriptions. Does the plan have coverage restrictions such as prior authorizations? How much are you going to pay at the pharmacy for each prescription? So are there co-payments or co-insurance? How much will you pay for monthly premiums and annual deductible? What's the service area for the plan? Obviously, you want to pick a service area that encompasses where you live. And then can you fill your prescriptions at a pharmacy that you currently use? Can you fill your prescriptions when you're traveling? Are there going to be extra costs if you go outside of your network? And then what is the total drug cost covered in the initial coverage period? So most plans have a maximum amount of $4,020. If your drugs cost more than that, then you're going to pay a little bit more during what they call the coverage gap, also known as the donut hole. If you reach a total drug cost of $6,350 per year, $6,350 per year, then it goes to something called catastrophic coverage, and your costs go down again. So the Medigap report, this customized Medigap report, helps you find and select the best policy for you with the strongest companies and for the least amount of money. Everybody's different, so We want you to make sure that you talk to your doctor about your future healthcare needs to make sure that you're selecting a plan that's going to have what you need for your future. Once you've selected a plan, talk to the insurance company that you have selected. Make sure that all your questions, any questions that you have, you ask them and get answers to them. And then also, if you want, you could reach out to a SHIP counselor. SHIP is a state health insurance assistance program. And as you see, we have a website here. And if you go to that website, you can find a local counselor, and you can set up either an appointment by phone or in person. But that website here, https://www.shiptacenter.org. So great resource there. So time to run your report. So we're going to go to the Crown Point website, and you're going to select research, select database list, scroll down and click on financial rating series, and then you're going to have to log in with your library card. But let's go out to the Crown Point website and take a look. So here we go to research and slide down to database list. And come down here, we're going to scroll down to, here we go, financial rating series. If you click here, you're going to need to sign in. So click sign in and then enter your library card here. Unless, of course, you have you've already established your own personal account, in which case you would put in your email address and your password. I, however, have got this loaded up already. I don't have a library card, so here is my login. And here we go. We are going to come over to all right, so we're going to click on Medigap. Type in your name. I'm just going to put in an initial, which you could do. You just have to put something here. You do have to put in an email address. We don't collect these email addresses and sell them. This is strictly so that we can send you your report. You won't have a, inbox full of spam that was generated by our selling your email address to lots of people. So I'm putting in my email address. And I'm going to say 65 for the age, female, and the zip code for Crown Point 46307, and tell it to get the report. This is going to take about 30 seconds for the report to load up. And I actually have a report already set up, but I'd just like you to see this because it is pretty quick. So there you go. You could click here and get the report, and then as you see, it says email sent successfully. I already have a report going here, so I'm just going to pull it up. And here we have the MEDIGAP report. The first 23 pages are what I would refer to as boilerplate. It's information that's going to be in every report, but it's really valuable information, and I would recommend that you read through it. It talks about some key decisions that you want to make, answers to questions about Medigap, talks about what does Medicare cover. We'll take a quick look here. It gives you some tables and shows what the benefit is, what Medicare pays, and what you will pay out of pocket. We talked a little bit about that in the beginning of the presentation. It goes through the skilled nursing facility, home health care, hospice, and blood. And then you come down here and it's got your Part B, which are your preventative services, medical preventative services. And this is a much bigger, longer chart because there's a lot more that's included. But it'll give you the benefit, what Medicare will pay, and then what you're responsible for. So, what insurance company should you choose? I'm sorry, which plan should you choose is what I wanted to show you. So here's that chart again showing the benefits. Again, A being the least inclusive for anybody signing up now. G would be the plan that you would go for the most inclusive. And then let's take a look at rates. So I mentioned earlier that these rates are, once we get into each plan, so we're in Plan A and these are the rates for Plan A. Come here, so Medigap premium rates for Plan A, and then as you can see, these are the companies with a safety rating of a B- or higher, so B- on up to A+. And then they are ranked by cost. So first is the least expensive. So we have $1,122, and as you see, we come down, and the most you could spend for with a company that has an A+ through B- rating is $2,716. Come down, you'll see that we have the C-rated companies here, and you could spend as much as $2,415 on this plan for a C-rated company. And if we come down, you'll see that really the most expensive rate that we've seen is with the D-rated company. So actually, there's more. So that shows you how it is set up, how it's organized, and then really puts a fine point on how you can see the different rates. So we also talked about Plan G. Let's take a look at that. Here we have, again, here is the first page of Plan G. You have the premium rates, and we have the companies with the safety rating of a B- or higher. And so here we have Great Southern Light. Here we have the first in the list at $1,322, and then if we come down, we'll see that the prices are going up as we come down. And so down here we have the most expensive plan within this A+ through B- rated companies is $2,818, and come down, you see we have all of the companies with the C- to C+, or C+ to C-, however you want to look at that. And then again, ranked first by cost coming down, and then all the way down here, and then to the D-rated company. So you can see you certainly could spend a lot for something, but because it is organized so that you first buy the safety ratings and then by cost within each safety rating, you're able to find the plan that meets your budget, if that is in fact the plan that you want. Last thing I would show you is as you come down here, we have an index of all the insurers that are listed here. In many cases, we do have a phone number, so once you pick a plan, you can then call up that insurance company, ask all your questions, and get all the information, and even sign up with them on the phone, or go and do it online if you want. But I would say you want to get your questions answered first. And then we have some reference organizations. So if you've got more questions, you want to do more research, you have the opportunity to do that, because we're giving you all of the information, well, a lot of information here, so you can go to these websites or call these folks up and speak with them. So that's all the information that I have for you. I appreciate your time today. If you have more questions, I would say talk to the folks at the reference desk and let them know what your questions are, and have them forward them on to me, and we'll get you the information that you need. Thank you again for your time.